when the real impact of COVID-19 started to sink in and the potential effect of public services was being modelled, it was good to see that our town council contingency plans appeared to be robust enough to cope with the wide-scale disruption of the day-to-day normal services. However, it soon became clear that some serious tweaking would be required, as this was nothing we planned for. It wasn't a major flood, there was no widespread failure of domestic services, and of course we had no idea how long this would last or how many people would be directly affected. It was obvious to me to think that we needed to think on our feet and make some quick decisions that were adaptable and could change with the changing situation. I knew that funds would be needed for volunteer expenses, to buy resources such as hand gel, volunteer lanyards, printing costs, etc., possibly food purchases and emergency transport costs. I didn't exactly know, but I knew that a grant would definitely would help if it was on hand. Faringdon has a population of just over 8,000 and a vibrant community spirit, as any of you that know Faringdon will agree. Quickly, Facebook posts appeared with offers of practical help, and the weekend that lockdown was enforced, leaflets were distributed to every household by a team of volunteers under the banner of Faringdon Viral Kindness. It was organised by Al Sylvester, and Al's a volunteer whose previous experience with the RAF Mountain Rescue Service definitely stood him in good stead to organise the team. The leaflets contained information about the new neighbourhood initiative and how volunteers could help those that were self-isolating and where to go for additional help and advice. Mobile phones donated by a local Tesco were attended 7 days a week initially, and systems soon evolved for mass collecting of prescriptions and shopping, etc., as we got more efficient systems in place for doing that. A communications team shared up-to-date information about available places to get provisions and assistance by using a Google Docs system and accessing information via the Oxfordshire All-In bulletins, which were very useful. Volunteers continued to trickle in as furloughed staff wanted to contribute and do their bits. All this happened extremely quickly, and I think we can thank effective partnership working with the town, district and county councils, linking with our local Vale of the White Horse medical practice management team and other established agencies need a mention, like Citizens Advice and Wantage Independent Advice Centre, who all got mentioned on our leaflets. There is no doubt that the volunteers of FVK and their amazing efforts did alleviate extra burden on stretched established services. Not just that, I really think it gave Faringdon's wider community confidence and comfort that some support was there should they need help, or even just a friendly chat at a time when friends or family couldn't visit. In actual fact, FVK has not used much of the funds. Gifts in kind have been donated and volunteers have not claimed reimbursement for expenses incurred, but it was great to have that buffer there if we needed it. Faringdon's Family Support Centre, the place, has had to adapt to new ways of working, and they assist some of the very vulnerable young families in our community. Things like breastfeeding tutorials are happening via Zoom, and the toy library has been in great demand, as I'm sure you can imagine, and obviously the logistics of cleaning and transporting equipment at this time has been challenging. Informal volunteer effort has been drawn on to back up support in lots of different ways. Domestic abuse cases requiring additional support and victims of domestic violence being moved into our area have drawn off resources that would have previously been supplied or loaned via other informal networks. People lend stuff that they know is happening, or give stuff willingly, but obviously that couldn't happen. People couldn't collect things from the doorstep, etc. Other support, such as the church groups, are not able to physically meet, of course, which has left a void being filled by informal volunteer effort without the umbrella, perhaps, of an established organisation. And again, like Wantage, Faringdon Food Bank has seen a short, very big increase and more than doubled in people as visiting and needing food as people become destitute, really, with little or no income and debt arrears mounts. Identifying ways of practically helping, not only with food, but also identifying and triggering signs such as ill health, high levels of depression and anxiety. Let's identify those and make referrals, giving support as and when appropriate. Our community bus service obviously had to stop, but we're aiming to get that back on the ground soon, and that's volunteer-led and manned. And we'll be looking, for protective equipment for them, maybe a sanitary station with gel and things like that to help people be safe.
It sounds wonderful, a real military operation. And I mean, they're always the best, I'm afraid. The armed forces know how to run things. But gosh, well done. I mean, it's just incredible what you've achieved. I'm sort of so conscious of all the school children who've had a pretty difficult summer, really. And I just wonder, with all the sort of support groups, what might be able to be done in the sort of summer holidays to help children.
I think it's a very interesting challenge for us, really. We're tending to focus on the immediate crisis and getting people fed, but the implication to what that really means longer term, sort of going forward for people on a day-to-day basis, it's sort of, it has made a huge impact. People are going to talk about this, the kids are going to talk about this forever. It will define them, and the parents will talk about it forever. We will talk about it. It's like, this is history in the making, and we'll be judged on how we deal with the coming out as well as the going in.